Good afternoon. It's Mayor Turner. It's July 1st. I want to get you caught up. There are some breaking news today as regarding COVID. We start with the numbers like we always do. Amarillo's at 3762. Lubbock is at 2,095. Abilene is at 977. San Angelo's 299. And the Midland is at 651. Just before I go over the Odessa numbers, I do want to say, if you're going to the state's website, the numbers on there are wrong. They say, I think it's about 650 or something. It has to do with the probable versus a confirmed. They cannot use the combined number because you have some counties that are doing one thing, another county's doing another thing. And so the state's decided not to count the probables, which are actually positive tests. So right now we just got our numbers. We are at 1,044. We have 1,526 tests that are pending. As I've told you, the lab is actually basically gone offline for the next 10 days. So that will be a problem. If you get tested and it's sent off to a lab, it could be 10 to 12 days before you get them back. We are actively working on that as a city to be able to come up with a better, another source for testing. But as of right now, we don't have any. We have 9 deaths now. They had a gentleman who passed away in the Metroplex last night, but he is an Ector County resident. And we have 388 recovering. Talk a little bit about Medical Center. Medical Center is diverting any cases from outside the county. In the past, they're kind of the regional hospital, but right now they are diverting because of the numbers they are getting. Right now they have 34 COVID patients in Medical Center. They have 10 in critical care, and they have 550 tests pending. So Medical Center is having a lot of trouble because simply of the number that are people that are coming in. ORMC has 9, 8 of which are in ICU. They discharged 2 yesterday, but they gained 3, so their numbers were a little bit off. And they are preparing another floor to be opened up for a COVID unit. I want to talk a little bit about Medical Center. They have 240 patients right now. That is not their capacity of patients, but we are reaching the capacity of nursing. Unfortunately, Medical Center has had 20 staff members that have caught COVID in the community. They're not getting it in Medical Center because they're gowned, masked, and everything the entire time they're there. But they have 20 staff members who are out in quarantine because of positive test. Right now, ORMC has 8 staff members that are positive, so they are out. Right now, Medical Center has opened another floor for COVID patients. They've opened the 8th floor, and like I said before, they're diverting, which means they divert ambulances. If you cut a finger, things like that, it's really going to be difficult to get into Medical Center. So that's something that we are having to work on. And as of right now, elective surgeries at Medical Center, if that person has to stay overnight, are being canceled because they cannot spare the beds for an elective surgery. Now, if it's a heart attack or something like that, they will be able to have a bed for those. But that's what we're looking at the hospitals. Give you an update real quick on the nursing homes. Focus Care has 19 cases. 17 of them are active. Sienna has 6 cases, 4 of which are active. Madison has 6 patients, and 6 are active. Buena Nursing Home has 1. Deering has 1. Parks has 1. And Courtyard has 1. This is kind of the day I've been warning y'all about. we are actually in a surge. There are two definitions of a surge, one of which is if you've had an increase in the percent of positives, which means June 1st, 6.9% of the test were positive. As of today, it is 10.9% are positive of the test. So basically every 11 out of 100 are positive. So by definition, we are in a surge. But once you get over 10% positive, like we talked about, every 10 is positive, that is technically a surge. What are the big concerns? One, it's all the cases. Number two is what we are seeing surrounding us. Midland is having trouble. They're not having the numbers we are. Alpine is having trouble. Ward County is having trouble. Of course, you have the prison down in Fort Stockton. They are having some trouble. But we are in that area we didn't want to be. Anytime you go from June 11th at 257 cases, now July 1st, we are at 1,044 cases. That's concerning. Right now, we are having trouble getting the numbers from the health department simply because they are overwhelmed. And they are getting so many cases, they have trouble because there's things you have to do, put them in a computer, things like that, to be able to get them back. So we're here. Now what do we do? We have Russell he's the CEO of Medical Center, has talked to Representative Landgraf. I'm going to call Representative Landgraf after this to tell the state that we are handling it and we have a plan. Last thing we want is to have the state come in here and start telling us what to do in our community. So let me give you a little bit of update on testing. Tomorrow there will be 2 rounds of testing. Tuesday we had our first testing that the city is putting on, where you spend about $750,000 of our care money to be able to go ahead and do some testing. This testing is free. We had 200 tests, which is what we have given to us by the lab. We can't just do as many as we want. We have to contract with the lab. So what we're doing is they had 450 people show up. So this Thursday, there will be testing at the volunteer fire station west of town, and there will be testing on the park in the south part of Odessa, and there will be up to 200, and that's all they can do. So that's, if you want to get a test, it is free. The only things I would ask is, if you've been exposed, don't run out and get a test right then, because if you have to pay for it, honestly, you're wasting money. What you need to do is wait 5 to 7 days or until you have symptoms. You have sore throat, you can't smell, you can't taste. A lot of it's like the flu. If you have those type of symptoms, go ahead and get tested. So we will have those going on. Want to give you a little bit of update on our friends to the east. Midland Memorial is slowing all of their elective surgeries for the same reason. They need to be able to hold the hospital space. Right now, when it comes to the city, we have Odessa Fire and Rescue has 3 positive and 3 that are waiting for tests to come back. Unfortunately, like we've talked about, to get those tests back, it takes quite a while. Stacy over at ORMC is doing a fantastic job. They are just now getting the test back that they did last Monday and Tuesday. So it kind of gives you an idea of how long it's taking to get these tests. Talked to Chief Gerke over at PD. They have 3 positives. They have 4 that are in quarantine, waiting for their test to come back. And so we're waiting for those to come back. Yesterday, we ran out of ambulances. As our city has grown, this is one reason council has approved rebuilding one station and building another. We simply, as our community has grown, have not been able to keep up with the ambulances. So we have plans in place, but unfortunately, we do run out of ambulances because of the amount of people going back and forth. Unfortunately, if there's, say, a bad car wreck, it could take 2 or 3 ambulances. Well, we only have 8 ambulances. So fire is watching to see that, to make sure that we get everything is taken care of. And I have the utmost faith in our police and our fire. So they will take care of that. I do want to talk a little bit. They still need some more tracers at Ector County. If you go to First Staffing, that is where the application is. So you're welcome to go there and get those numbers. And, you know, they've already hired 11, which is fantastic, but they still probably need 4 or 5 more. The health department is just overrun. I talked to Brandy, who is in charge of the health department, dealing with the amount of tests that they're getting. One question a lot of people have asked is, well, what if I have 4 tests? Just use me as an example. I've just had 1 test, but say my employer says you have to have 2 tests to come back to work. Are those counted as 1, or are they counted as 4 or 5? What they do is the health department has a list. It's required by the state with the name of the person who is getting the test. Once you have 1 positive test, you're on the list. If you have a second positive test, they go through the list, find your name, and don't count it. So those are not being counted twice. And a lot of people say, well, we're doing more testing, which means we're going to see more positives. It's true, yes and no. We are seeing more positive because when we first started COVID, it was 1 out of every 17 tests was positive. 2 weeks ago, it was 1 out of every 11. I'm sorry, 1 out of every, it was 11. Now we're going on up, and that's the scary part. I know the mask issue is some people say, well, it's freedom, you're taking my freedom. Well, you know, some people say we need to do it, and I fully agree with those that say we need to do it. Let me give you some names of some businesses and organizations that will require you to have a mask before you go there. Odessa College is requiring mask. UTPB is requiring mask. If you go to City Hall, we require mask before you enter City Hall. ECISD, the talk is right now they are going to require mask on certain aged children, and HEB is now requiring mask. I am reaching out to Walmart, and I'm also reaching out to United, which is the company that owns the Albertsons. And so I'm going to reach out and talk to them, see what their policies are going to be, but I would not be a bit surprised if they did not start requiring masks. You know, some people say, well, I'm not going to wear a mask. That's fine. But a business isn't going to let you in if you're not wearing a mask. So it is up to that business. We will have an update here in the next day or two. We should get some more numbers on Friday, and I will get on and give you all the update on the numbers. You know, I would expect at least 100 from what I'm hearing that we will increase. So we are just going to have to, as a community, do everything we can to stop this. So, you know, sorry news isn't better, but I still haven't heard exactly what the school districts are going to do. They are still looking at our numbers, and our numbers are going to change what they're going to do because that's just the reality. They can look at the state numbers, but the relevant numbers are the ones here in Odessa. So just wanted to give it to you. Please pray for everyone, especially those that lost loved ones. Now that you know that medical center is diverting, you know, it's going to change. If you get hurt this weekend, you may want to try one of the emergency clinics. You may be able to still go to medical center. It depends upon how many they have. But God bless each and every one of you. And please stay safe, wear your mask, and continue to wash your hands. Thank you very much.